Now, let's move gears a little bit, Mike. Let's talk about long term. Let's talk about January. Long term. That, for us, that's a long time from now. But let's talk about that for a second. And we're a small employer. We only have 25, 26 employees here. We are what's called, what I'm told is called a grandfather plan. Can you talk a little bit about what that means? And I'll tell you why I'm asking. I was trying to get our rate quotes. Our plan year starts in January. So I was trying to get quotes for next year for planning purposes. And I've heard all the horror stories, anywhere from 40 to 80% increases. So I was asking our person what it was going to be. And I was told that since our plan was grandfathered, our increases might not be, let's be careful, might not be as high as you would think because of the grandfathering of a plan. I'm not sure I know what that means, but it relates back to this particular.
Well, if you'll remember back to when PPAC, healthcare reform, was passed, there was a lot written and a lot used in the proposals about if an employer had a plan, that they would be able to keep that plan so long as they didn't make material changes to the plan. There's a list of requirements for an employer, regardless of the size of the employer. You did make reference to smaller plans.
Right.
You can stay a grandfathered plan regardless of size. The rules regarding grandfathering simply require that you not make a lot of changes to the coverage rules, and that you maintain an employer and employee sharing ratio for paying the required premiums.
Okay.
I'm summarizing those rules in a way that they are somewhat detailed. So you would want to take out a statute or a summary of the statutory requirements and make sure you go through that process. Now, I would point out that a lot of carriers, such as Blue Cross, have established a process and procedure for helping their clients with maintaining grandfathered status for the plan.
Yeah, and where that came from, Mike, is there were some people that I talked to in South Carolina that had said there were January renewals. They were going to change their renewal dates to actually renew early. So their renewing date would have been in 2013. And I had heard, again, maybe wrong, but I had heard that by renewing early before January 2014, that you might could get a break on your rates because all of it wouldn't be in effect when they did.
Yeah,
Does that make sense?
when we get to January 1st, there are some new coverage requirements
Right.
that would apply across the board, some to all plans and some to non-grandfathered plans. So I could see that there would be a premium difference. With respect to your question about changing plan years, honestly, I'm not up to speed enough to answer that question.
I understand. I just heard that was going on, so I wanted to ask you about it. I read in the paper this week, Home Depot has decided to cut health care benefits for their part-time employees. And it was in the state newspaper, so it's not a secret. As I read through that, it sounded like what they're saying is, we've got these part-time employees, and we're providing health care coverage. We're going to no longer cover them and allow them to get it through the exchanges. Is that something you've seen other clients do, or is that out of the norm?
Well, first of all, I don't represent Home Depot, so I'm not exactly sure what their decision process has been.
Right.
There could be a variety of things behind that decision. One could be that the plan being offered to that part-time group may not satisfy the requirements of a group plan going forward. So Home Depot may have made a decision that they were going to go ahead and start, although the employer mandate has been moved off a year until January 1, 2015, they may be positioning their coverage policies to match up when they move over. Now, as well, with depending on earnings level of the coverage group, this could be a second reason. There could be a cheaper alternative for that workforce, in as much as there'll be subsidies when an individual goes to the marketplace or the exchange. So that part-time workforce may have a lower earnings level, be eligible for subsidies. You know, the group that's between 100% of the poverty level and 400% of the poverty level will be entitled to a subsidy to help pay full coverage on the market.
So they might end up with a cheaper rate.
Absolutely, with better coverage at a cheaper rate.
Let's talk about rates for just one more second. You mentioned the rate, we're talking about grandfather clauses and those kind of things a minute ago. I think this is what I heard. If you change your employee premium, what you charge employees as an employer,
Right.
dramatically, 50–60%, that would impact your grandfather status.
That potentially could. Now, let's talk about that because we need to make sure we understand this, because if the overall premium goes up, the employer can increase the amount that the participants required, the employees required to pay.
Okay.
It's just that the sharing percentage cannot shift more than 5%. So in a simple example, if the employer's been picking up 90% of the employee-only premium and the premium goes up 50%, they could still share 90–10 of the increased premium.
It's a ratio to what it costs you as
Absolutely.
an employee to what you charge employees.
That's correct.
You know, Mike, one thing that I've heard a lot about, and I'm not even sure I understand it, is something I think they call SC shops.
Right.
And if I understand it right, it's for small employers.
Right.
They can go out on the web and basically do the same thing on the web that individuals are doing. They're looking for individual insurance that a small business might could go out there through SC shops and find coverage for their employees.
That's
Can
right.
you talk a little bit about that?
Yeah, and this is general because I've done a fair amount of reading to have a general knowledge, but I can't say that I have a large depth of knowledge about South Carolina SHOP. But the concept is for smaller employers, and as I understand it, the early definition will be those employers with 50 or fewer employees can go to South Carolina SHOP and get a group medical plan that's guaranteed issued. So they're not subject to underwriting, so the group policy would be issued so long as it's issued according to terms and made available to employees. And the underwriting standards are standard from employer to employer, and so that there's a group pooling concept to help with the pricing. And why is that important? It's important because if you have one or two folks that have had high claims, it won't necessarily take you and price you out of getting a group policy for your workforce if you're a smaller employer.
So what I'm hearing is you have the option of looking into maybe taking 100 small businesses with 30 employees, and then you've got a large pool to spread that risk over.
That's right.
And thereby taking, I guess, a discount like a large employer would.
Yeah, well, that's right. Or gaining a better price because we have a bigger pool of individuals
You're bringing that many lives.
that are being underwritten in a larger pool. That's right.
Thank you, Mike. Well, Mike, I appreciate you taking time to talk to us a very short period. I know it's, you're busy, and I appreciate you taking time to do it.
Thank you for having me.
What can our people call you if they have a question?
Oh,
as they read this?
absolutely. Yes.
Mike Brittingham, Nixon Pruitt. We'll put your phone number across the bottom so everybody can see it.
Awesome.
Mike. Thank
Good.
you so much for
Thank
being
you.
here.
Absolutely.
Bye.